Hi, everybody. September is the PCOS Awareness Month, and let's explore more questions today. Hi, I'm Rashmi Gopal. I'm an integrative nutrition health coach, and we have Dr. Anupama here, who's an Ayurvedic fertility specialist from Shrestha Ayurveda. Welcome, Doctor.
Hello, Rashmi.
Doctor, many women are told, don't worry about PCOS, come back when you want to conceive. Is that the right approach?
Definitely not. It's actually a very tragic thing that women are told this. Usually, when they approach their doctors with irregular periods or with an already diagnosed PCOS condition, they are asked whether they are trying to conceive right now. And if they don't have any fertility plans soon enough, they are told either to lose weight and manage their PCOS and come back only when they have decided to have babies. This is a very unfortunate approach, I would say, because there are several reasons. First thing is women are supposed to have periods. The cyclic bleeding is important for the uterine health. That is number one. And second thing is multiple research studies have shown that PCOS women are vulnerable to many metabolic conditions like diabetes, obesity, cardiovascular conditions, hypertension, high cholesterol, which can affect their overall health. So PCOS has to be addressed. And one more reason I can think about is their mental health. Many studies have shown that PCOS women are more likely to have mental health conditions like depression and anxiety than non-PCOS women. And when the PCOS is not addressed, this can get only worse. That's very important. And apart from that, the skin and hair health, the facial hair, the hair thinning, the acne can really affect the quality of life of these PCOS women, which is something which can be addressed and which can be treated. And even when we come to fertility, if they're think of it as future fertility, untreated PCOS makes it even more difficult for them to conceive in the future. So overall health is absolutely important. We have to look at it. That is the reason we call it PCOS. It's a syndrome. From your hair to the tip of your toe, it affects all the systems. So it has to be addressed whether the female is ready to conceive or not, whether there's fertility plans or not. So basically, PCOS is not a fertility challenge, not just a fertility condition. It is an endocrine metabolic function which is affecting multiple systems in the body. So to maintain overall health, it is not possible unless you address PCOS. So go and lose weight and come back when you have a baby is something women should not accept, and PCOS women definitely deserve better treatment, and the PCOS has to be addressed based on the condition, but it has to be addressed and it has to be treated at the right time.
Absolutely. Thank you, doctor, for throwing light on this aspect of PCOS.
Okay, so when it comes to nutrition, I'm sure you've heard this that there's so many myths about diet over there, outside there. So about PCOS women should just stop all carbs and they should avoid gluten forever. They should avoid dairy forever. There's so much out there, and people are really having analysis paralysis with this overload of information. So in your work, how do you address this? What is your opinion about this?
First of all, there are just like there are different types of PCOS. Even the diets has to be, customized for the particular person. So, and then I definitely avoid all generic advice, generic guidelines. People should definitely avoid all that generic advices. And then, depending upon their hormonal condition, whatever hormonal imbalance they have and their gut health, the diet has to be customized. So sometimes, yes, I customize their diet in a way that elimination of gluten and dairy might be necessary, but not always. It's sometimes temporary, and it can always be reintroduced. So it's very particular to that particular person. And then unless there is a known cause of gluten or dairy allergy or intolerance, it's not always necessary to avoid gluten and dairy. And with respect to carbs, doctor, yes, um, it's not always bad, definitely. So, no, I don't ask them to remove all carbs. Uh, there are two things. One is, moving to healthier carbs is necessary. Then, proportion of the carbs in the healthy plate has to be seen. So, it has to be a wholesome meal, and the amount of vegetables or the protein or good fats actually helps us to remove or reduce the amount of carbs in their healthy plate. So that helps a lot with PCOS and also their insulin resistance. This is how
Actually,
I.
very advice, something which is doable instead of eliminating everything and following generic advice. Let's keep exploring more questions. People can send their questions to us directly, and we will address them soon in more videos.